Surprisingly and by chance, there was an accident in that island and there was exactly a patient needing support. And in that moment, even during the demo, they were able to immediately provide advice and support that person that was in risk of life.
Welcome to the beautiful island of Madeira in Portugal. I am standing in front of a demonstration booth of the innovative digital health project funded by the European Commission. This is the story of how a group of innovators set out to build a European telemedicine network to save lives. It was a vision that became a reality.
The ICU4COVID, the first one, appears at the right time because we have the COVID here in Madeira. And it was a new way to approach the patients with security of our health professionals and with security for our citizens.
The pandemic highlighted something that had already been highlighted, that is health and digitalization, for especially the health professionals and the citizens.
Because the use of the artificial intelligence, augmented reality, virtual reality, robotization in surgery will help us managing with more secure, with less costs for the management of our health system in Madeira.
The vision of the project started more than 10 years ago after I moved to Aachen for my chair in intensive care medicine. Aachen provides a combination of medical and famous technical faculties, and there was the ideal place to develop intensive care medicine for the future, hence making telemedicine between units real. We started with a pilot project, only 3 hospitals, including my own, and this was quite a successful pilot project, and therefore we moved on. We moved on to more broader projects, and the European Commission needed support in terms of fighting Corona, and we basically offered our ideas, and now with 9 member states we are establishing these kind of telemedical networks in each member state, but also all together, that we're backing up each other. And I see here really a European-wide structure, a European-wide innovation, and it's really to save more lives of European citizens.
The concept of the project was to develop a cyber-physical system for telemedicine and intensive care, which we call the CPS4TIC framework. So this solution will enable that the healthcare workers can develop the clinical activities not being close and in the place where the infected patients are staying.
The patient data management system, basically the tool that aggregates all the data, where you can do all the documentation, but also the prescribing of medication and so on. Powered by artificial intelligence, the system automatically extracts information out of the data that is in the system to give you as a medical doctor an overview about what happened during the last 24-48 hours. This can be shared to the person who is consulting you, and we could now initiate a telemedical call to this screen, right? And to show not only via the camera the environment, but at the same time the same information we see in this situation.
The health condition of the medical team is also addressed by using sensors and wearable devices to monitor their physical condition and provide them with direct feedback to enhance the well-being.
We can have the main hospital and peripheral hospitals or even health centers where the doctors don't need to move to the health centers if there's the need of some specific clinical activity. Like the case of Madeira or of Azores that are based in different islands, if we have a patient that, for example, is in Porto Santo, that is a small island out of the main island, that is Madeira Island, this patient, mostly of the times when their is find the need is moved by helicopter or by plane to the main hospital. And using this solution, this can be at least assessed properly remotely, and probably in most of the case, even the need of the transportation of the patient can be avoided. Also, it's very relevant the need that this project had to face to integrate the different devices that are around a patient bed and integrate it with patient data management system. And here, the interoperability aspects on the integration of the data with the telemedicine system is a very valuable asset for this domain. Why? Because nowadays, typically in the hospitals, the data of a patient, even if it is standardized, is mostly distributed and not integrated.
Just to give you a number, we are talking about more than 1,000 data points in intensive care medicine that are produced per hour, per day in intensive care medicine per patient. So we have to deal with this a lot of amount of data.
I could say that the creation of this database, this new database, is very important for our island because it's going to give us the opportunity to investigate this data, to analyze this data, and to, with the conclusion, have the opportunity to change some of the treatments, some of the imagiology that we are using in our patients, in our diagnosis, could help us to have a better decision making in the health system, in the healthcare system.
So the vision here is really to use the data not only to treat this particular patient, but to aggregate these data, to make large databases, and then you can develop AI, artificial intelligence algorithm with machine learning algorithms. And here I see a very high potential.
The main challenges in the project ICU4COVID are that we really have to not only bring new technology to the patient bed, but to also change the workflow, how to do the clinical treatment with the intensive care patients.
We need obviously colleagues that are having skills, digital skills, and this is something we need to involve, to integrate into our curricula. And this is what we are doing right now. We just will start now a master program of digital skills for health with many partners from different member states. And the idea is that we train our juniors up to scratch, that they really can use the potential from the technology, from all these innovations, in order to transform it into the clinical side at the patient's bedside.
There was no doubt about the project impact in the sense of medical, technological and social manner. Co-creation was the core value in this project. It involved all stakeholders in the process and centered the citizens as well as the clinical staff.
The citizens' reaction to the projects was actually a surprise by somehow, because we find that they are very much willing to cooperate and to introduce new ways of being empowered by their health. And this is a very nice feeling that we are doing something for others also.
This initiative has had a great impact on our participants' lives. They feel taken care of, they feel they have some sense of security because their health is being monitored by a great team of professionals, healthcare professionals. So I believe it has had a very good influence on their health.
If we invest in the health of our citizens, we are investing in the health of our planet.
ICU4COVID project is to provide the best medical treatment to everyone, everywhere, anytime.